For 4 long years, individuals who dared to question the safety of mRNA COVID vaccines were often labeled as fanatics or crazy conspiracy theorists, facing social ostracism and professional difficulties. But what happens when these voices are no longer isolated? What happens when scientific evidence and говорящие цифры, telling numbers, increasingly support those initial concerns? What if reports of serious cardiovascular events, even fatal heart attacks post-vaccination, are no longer dismissed as mere Einzelfälle, isolated cases? Is a certain truth being deliberately concealed? Welcome back to our channel, a place where we never shy away from uncomfortable truths, where the community's voice is always heard and respected. Today, we will delve deep, analyzing frankly and in detail one of the most controversial and worrisome issues of recent times: the true potential link between mRNA COVID vaccination and the cardiovascular health of millions. We must emphasize that the purpose of this discussion is not to sow panic or to baselessly reject science. Instead, it is to systematically present what we have learned from research, from the analyses of independent experts, and, most importantly, from the very experiences and stories courageously shared by our audience. Together, we will seek transparency, because every one of us deserves to know the full truth to protect our own health and that of our loved ones. When discussing the cardiovascular impact of mRNA COVID vaccines, the term most of us have heard is myocarditis, an inflammation of the heart muscle itself. Indeed, early warnings about this risk, especially in young men, emerged quite some time ago. In a previous video, we analyzed a comprehensive review presented by Dr. Kurt Kirk-Milholm, a pediatric cardiologist. This 42-page review, referencing 341 other studies, is not an isolated voice. It is corroborated by large-scale data, notably a significant study from Nordic countries that monitored the health of over 23 million children and young adults. The results were clear. Unvaccinated individuals had the lowest rate of myocarditis, and this risk increased significantly with the number of vaccine doses administered, or when using the Moderna vaccine compared to Pfizer. These findings sounded a strong alarm regarding the safety of these shots, particularly for young and healthy populations who inherently had a very low risk of severe outcomes from COVID-19. However, the picture of the cardiovascular impact of mRNA COVID vaccines does not stop at acute myocarditis. Scientists and independent doctors worldwide are expressing increasingly profound concern about potential, prolonged, and possibly far more severe consequences. A notable study published in the prestigious medical journal The Lancet followed up on cases of post-vaccination myocarditis. The results showed that even after 90 days, many patients still exhibited signs of inflammation and even potential scarring on cardiac MRI scans. This indicates that the damage does not simply disappear quickly, as some initial claims suggested. Perhaps one of the most alarming findings comes from a Yale University study. This research discovered that the spike protein, the very component that mRNA COVID vaccines instruct our bodies to produce to generate an immune response, could persist and circulate freely in the blood of some individuals for over 700 days post-injection. This directly contradicts the initial assumption that the spike protein would only be present for a short period and be quickly eliminated. Notably, this same spike protein has been described by many experts, including early researchers of mRNA technology, as a cardiotoxin, a substance capable of directly poisoning heart cells. So, let us ponder. If a cardiotoxin, like the spike protein, can persist in the body for hundreds of days, what consequences might it cause? Scientists worry that this prolonged presence could trigger a state of chronic inflammation at the cellular level, causing slow but continuous damage to heart muscle cells and the endothelial lining of blood vessels. It might also contribute to the formation of microclots, impair the heart's pumping function, or induce dangerous cardiac arrhythmias. All these factors, chronic inflammation, cellular damage, vascular dysfunction, and the risk of thrombosis, are known components in the pathology of severe cardiovascular events, including myocardial infarction, commonly known as a heart attack. Worryingly, these risks may be present even in individuals without traditional cardiovascular risk factors such as advanced age, smoking, diabetes, or hypertension. This raises an urgent question about comprehensively and objectively reevaluating the risk-benefit balance of mRNA COVID vaccination, especially concerning repeated booster shots. When we hear the words heart attack, the first image that often comes to mind is sudden, severe chest pain, a feeling of a heavy weight on the chest. And indeed, that is a classic symptom of an acute myocardial infarction. But medical reality is far more complex. Not all serious heart problems, including damage that can lead to heart failure or life-threatening events, manifest so loudly and clearly. There is a concept known in medicine as a silent heart attack, meaning heart attacks that occur without typical symptoms or with very mild symptoms that are easily overlooked or mistaken for other health issues. This is the point we wish to particularly emphasize, based on countless shares and comments sent to our channel by viewers after receiving COVID vaccines. Many people, especially young individuals who were previously in perfect health, have described a range of unusual, persistent symptoms they had never experienced before. These include a chronic, inexplicable fatigue even after adequate rest, shortness of breath with only light exertion, feeling winded after climbing a few stairs, episodes of unusually fast heartbeat, palpitations, or a sensation of a skipped or irregular heartbeat, feelings of dizziness or lightheadedness, especially when changing posture, or chest discomfort, not necessarily severe pain, but perhaps a feeling of pressure, tightness, or a fleeting sharp pain that then disappears. These symptoms can easily be dismissed, considered insignificant, or even attributed to excessive anxiety or psychological stress after a stressful pandemic period. But they could also be early warning signals from the heart, indicating an underlying problem, a smoldering inflammation, or accumulating minor damage that, if not identified and addressed, could gradually weaken heart function. Sadly, and it is a harsh reality many of you have experienced, when presenting these anxieties and vague symptoms to doctors, they often do not receive appropriate attention. In not a few cases, individuals report going to a cardiologist, knowing their heart is behaving strangely, only to be told by every doctor that it's all in their head. This dismissal not only inflicts further emotional damage on patients, making them feel isolated and lose faith, but more dangerously, it can delay necessary tests to accurately diagnose the problem. In the context of a new medical product, like mRNA COVID vaccines, being rolled out naselenia to the general population at an unprecedented speed, and with increasingly clear warning signs about cardiovascular side effects, listening to patients and seriously considering all unusual symptoms must be a top priority for the healthcare industry. Every account, every symptom, no matter how small, should be considered a vital piece of the puzzle to better understand the overall picture of vaccine safety. The statistics from studies and the scientific analyses we have discussed are incredibly important. They provide us with an overview, a database for assessment. But to truly understand the depth of the issue, to feel the real impacts of COVID vaccines on cardiovascular health and people's lives, we need to listen. Listen to the voices from our own community, those who have directly experienced, witnessed, or suffered loss. Over time, our channel has become a place where thousands of viewers come to share, to confide, and sometimes to seek a little hope, a little empathy when they feel their voices are ignored elsewhere. Today, we wish to share just a few of the countless stories, authentic, painful, and unforgettable accounts of cardiovascular events, including heart attacks, that they or their loved ones faced after COVID vaccination. These personal narratives, describing sudden heart failure, heart attacks occurring mere days or weeks after vaccination and affecting even young individuals, paint a distressing picture. Stories of multiple family members succumbing to cardiac issues or young adults dying from myocarditis. After hearing these emotional stories and concerning evidence, many of you, especially those who have received one or more doses of an mRNA COVID vaccine, may feel bewildered and ask, "So, what should I do now? How can I protect my cardiovascular health and that of my loved ones?" First and foremost, we want to emphasize that your concern is entirely valid and deserves respect. The most important thing right now is not to panic excessively, but to remain calm, proactively seek information, and equip yourself with the necessary knowledge to take appropriate action. Your health is your most precious asset, and you have every right to protect it. Here are some specific, guiding steps you can consider taking starting today to monitor and protect your cardiovascular health, especially if you have concerns after COVID vaccination. Listen to your body and never underestimate unusual signs. This is the first and most crucial step. Become your own best doctor by being sensitive to any changes in your body. Never dismiss signs like even fleeting chest tightness, unexplained shortness of breath, an unusually fast or irregular heartbeat, prolonged unexplained fatigue, or sudden dizzy spells. Documenting the frequency, intensity, and circumstances of these symptoms can be very helpful when you consult a doctor. Seek medical advice from professionals willing to listen without prejudice. This can be challenging, as many have shared. However, do not be discouraged. Try to find doctors and healthcare professionals who are compassionate and willing to listen openly to your concerns related to COVID vaccines, rather than dismissing them or attributing them to psychology. You have the right to ask questions, receive clear explanations, and request necessary tests. Consulting communities and forums of people with similar concerns may help you find trustworthy medical providers. Proactively discuss specialized tests to assess cardiovascular health. If you have specific symptoms or concerns, do not hesitate to ask your doctor about more specialized tests to evaluate your cardiovascular status. Besides basic tests like an electrocardiogram or ECG or a transthoracic echocardiogram, other tests can provide more valuable information. For example, cardiac enzyme tests, troponin I or troponin T, help detect heart muscle cell damage. D-dimer test may suggest the presence of blood clots. Stress echocardiogram evaluates heart function during exercise. Cardiac MRI with contrast. This is a very sensitive tool, as Dr. Milholm mentioned, capable of detecting inflammatory lesions, small scars, or other abnormalities in the heart muscle that other methods might miss. Discuss frankly with your doctor the benefits and necessity of these tests in your specific case. Build a healthy lifestyle to support comprehensive cardiovascular health. Whatever the cause of your heart issues, maintaining a scientific and healthy lifestyle always plays a key role in protecting and improving heart health. Focus on a balanced anti-inflammatory diet. Prioritize green vegetables, fresh fruits, whole grains, oily fish rich in omega-3s, nuts, and healthy vegetable oils. Minimize processed foods, fast food, refined sugars, and trans fats. Regular and appropriate physical activity. Choose forms of exercise suitable for your current health condition, such as walking, swimming, light cycling, or yoga. Avoid overexertion if you have cardiovascular symptoms. Effective stress management. Chronic stress is a major risk factor for heart disease. Practice relaxation techniques like meditation, deep breathing, spend time on personal hobbies, and get enough sleep. Quit bad habits. If you smoke, find ways to quit. Limit alcohol and other stimulants. Document and report suspected side effects to regulatory authorities. If you or a loved one suspect you have experienced a serious side effect after COVID vaccination, including heart problems, proactively report it to your country's health safety monitoring systems. For example, in the United States, this is the Vaccine Adverse Event Reporting System, VAERS. Although these systems may have certain limitations and do not always prove a causal relationship, every report is valuable data, contributing to building a larger picture of vaccine safety and helping authorities make timely assessments. Connect, share, and seek support from the community. You are not alone on this journey. Seek out communities, online forums, or support groups where you can share experiences.